Yeah, just a quick review of the DOUFURT knee brace. So this brace is specifically made for people that have pain in their knee or some kind of knee problem. And the idea here is that, you put on the brace and it supports the joint, the surrounding soft tissues, and restricts its motion a little bit. So that way your knee has a chance to kind of rest, recover, and doesn't get so stressed out as you're doing things. So a few points about this particular brace. It is made of 20% nylon, which I think is really good. Because nylon is a very durable material, so I do expect this brace to wear well over time. The other thing is it does, this kind of sets it apart, it does has this patellar gel pad, that your patella is your kneecap. So it's got this extra layer here to kind of help, I think it kind of helps stabilizing your kneecap. So if you haven't had trouble with your kneecap dislocating, or you have done that in the past, or maybe it's off to one side more than it should be, I think this is actually a pretty good brace to try out for that. And it has these stabilizing straps on the front too. So if you need a little extra support more than your average like knee sleeve, this would also be a good option. So other things you can do for your knee, yeah, there's lots of other things actually. As an example, bulletproof your knee is where I'm getting this stuff from. If you have any kind of knee problem, you definitely want to make sure you're strengthening your quadriceps muscle. That's the big muscle on the top of your leg. Probably about any problem you can name with your knee. I can show you a study showing that, if you have, like, say, a torn ligament, you also probably have a problem with your quadriceps muscle. Being that your quadriceps muscle is, they're finding that it's either weaker than normal, or it is smaller than normal, like on cross-sectional CT scans. But yeah, they looked at like knee swelling. If you have knee swelling, it can affect your quadriceps. If you have any kind of knee injury, it can affect your quadriceps. If you had any anterior cruciate ligament, ACL tears or anything, there's a posterior cruciate ligament, your PCL, medial collateral ligament. Just having knee pain can actually affect your quads. And a big one here is knee arthritis. And actually lots of studies showing that actually if you strengthen your quads, it can actually keep knee arthritis from progressing. But yeah, definitely there's a lot of research showing that if you strengthen your quads, your knee arthritis gets a lot better. So yeah, definitely that's a biggie you need to be doing. Other things you can do, fine-tune control over your knee. Here they're talking about the hip muscles. A lot of times you can have a knee problem because of what's going on at the hip. So for instance, like iliotibial band syndrome, they find when they look at people with iliotibial band syndrome, they have unusually weak hip abductors. So if you strengthen your hip, and likewise they find if you take people with iliotibial band syndrome and you strengthen your hip muscles, then the iliotibial band problem goes away. So definitely what's going on at your hip can also affect your knee. And I think there's also some studies showing that if you do quad strengthening for knee arthritis and you throw in some hip abductor strengthening, that it's even better. So yeah, a couple things you can do there. Optimize knee flexibility. Obviously having a flexible knee is something that you'd want, stretching it out. A lot of people think your knee just bends and straightens, but it does another thing, it actually rotates. As this little test will show you, about the last 15 degrees of you straightening your knee actually rotates laterally or out to the side. So that's an accessory motion that you'll definitely want to get back if you don't have that. And the last thing is increasing knee stability. So here they're talking about proprioception. Proprioception is your position sense. So right now, if I turn the lights out, you could tell whether your knee is bent or straight, right? And that's because of the feedback from the joint and the receptors, the position receptors in your muscles and your joints, giving feedback to your brain so that you know at all times where your knee is, bent, straight, and so forth. But that's actually, they're finding decreased proprioception in people with knee problems. So it's actually something that you can change and do some exercises for. But anyway, nothing's as quick and easy as putting on a brace, stabilize your knee, take a little stress off of it, make your knee feeling better. So it's a good brace. Check it out.